Welcome back. Millions of Americans celebrated Thanksgiving in large groups despite warnings from health officials. Adriana Diaz is in Chicago, where busy hospitals are preparing to get even busier.
I was worried after Halloween. I'm far more worried after Thanksgiving.
Hospitals are bracing for a post-holiday influx of COVID patients. Dr. Mita Shah works in the ER at Chicago's Rush University Medical Center.
We will not get a reprieve because then Christmas comes and then New Year comes. So if we're just stacking surge upon surge upon surge, I am significantly worried about that.
The lobby at Rush has been transformed into a COVID triage area to make room in case there's a surge of patients in the coming days. And though a projected 50 million Americans still traveled for the holiday this weekend, outside Los Angeles, this bumper-to-bumper traffic wasn't for holiday travel. It was to pick up a Thanksgiving meal from a food bank.
So many people just appreciate being here, being able to get out.
In Northwest Indiana, volunteers rallied to keep a local tradition alive, turning a massive Thanksgiving feast for 1,500 into a drive-through celebration.
God, we lift up these families who are mourning the loss of their loved ones because of COVID.
For others, the holiday was a time to reflect on a difficult year. Members of a church in hard-hit South Dakota set up hundreds of empty chairs outside the state capitol, one for every South Dakotan who succumbed to the virus. And for the Spano family in Connecticut, dinner was tough without their brother and son, Daniel Spano, who's in the picture frame. He died from COVID earlier this year. Thanksgiving was his favorite holiday.
We're gonna video chat and, try to have some sense of normalcy, but no matter what we do, it's not gonna be the same.
Back in Chicago, like so many frontline workers, Dr. Shah spent her Thanksgiving in the ER.
You step out of your front door and you're sad that you're leaving your family on a holiday. But when you walk into these doors, this is your work family. And right now, my work family is hurting.
And here's why Dr. Shah and so many others are concerned. According to the city's public health commissioner, one Chicagoan is diagnosed with the virus every minute. Adriana Diaz, CBS News, Chicago.
And the true number of coronavirus cases in the U.S. may be much higher than what has been reported. That's according to a new study written by scientists who work at the CDC. The researchers created a model which found that by the end of September, an estimated 52.9 million people had been infected with COVID-19. That means the infections were about 8 times higher than the confirmed cases CDC reported at the time, which was 6.9 million. The authors wrote that most of the unreported cases were either asymptomatic or mild infections. And working out might be the last thing on your mind after a Thanksgiving feast, but the World Health Organization has released new guidelines for exercise and says you should actually do more. Adults should get at least 150 minutes of moderate activity per week. Those over 65 should include activities that focus on balance and coordination. Pregnant and postpartum women should also get at least 150 minutes of moderate exercise and strengthening each week, as long as there are no complications.